and has completed postdoctoral research and habilitation in Italy. With over 80 publications and numerous international awards, his research focuses on nutraceutical sustainable food systems and health sciences. He is also by the Royal Society of Chemistry for outstanding contributions. Please welcome Dr. Hamadullah. Please, sir, join us. Dr. Hamadullah, can you listen me, sir?
Assalamu alaikum.
Walaikum assalam.
Ji,
Yes, sir. Over to you, sir.
Yeah, I want to share presentation, but I don't know. It shows me some problem with the. Actually, I have some connectivity issues, so maybe that's why. Let me open it again. So maybe it will be. Yeah, now I got it. Presentation is visible.
Yes, sir. Please continue, sir.
Okay, thank you. Assalamu alaikum and good morning, distinguished guests, respected colleagues and fellow researchers. It is a great honor to speak at the first international conference on pioneering frontiers in science and technology. I sincerely thank the organizers, especially Ms. Marwa, for providing this platform to share our work. Currently, I am working as assistant professor in University of Naples, in University of Management and Technology, Lahore, Pakistan, and also I am affiliated with the University of Naples, 𝑭𝒐𝒏𝒂𝒂𝒍 Italy. Before joining University of Management Technology, I was working as adjunct associate professor in Xi'an International University, China. Today, I will present our research on food supplements for functional gastrointestinal disorders. Actually, my work is mainly on the comprehensive investigation of food by active ingredients with the final aim to develop nutraceuticals, food supplements, and functional food ingredients to promote good health. Especially this talk will explore how nutraceutical interventions can offer safe, effective, and evidence-based solutions for managing complex gastrointestinal conditions. Let me begin with a fundamental question. What are functional gastrointestinal disorders? Generally, we use different terminologies: gastrointestinal disorders, intestinal disorders, functional disorders, and functional gastrointestinal disorders. So what are functional gastrointestinal disorders? Refer to all disorders related to gastrointestinal tract. But what are functional gastrointestinal disorders? These are actually chronic digestive conditions where patients experience symptoms, but no structural abnormalities are detected. They are now increasingly understood as disorders of gut-brain interaction. Normally, gastrointestinal disorders will always affect CNS activity in the form of sleep, in the form of mood. So normally we link our gastrointestinal disorders or gastrointestinal functions directly to the brain. The key facts about functional gastrointestinal disorders are that it affects about 20 to 40% of the global population. Maybe the actual figure could be more than this, even more than 60-70%. But the reported is 20 to 40%. Among the most common GI complaints, I mean the functional disorders. Importantly, it not only affect gastrointestinal disorder, but it significantly impair overall quality of life. Regarding the pathophysiology, functional gastrointestinals are multifactorial that involve gut-brain axis dysregulation, visceral hypersensitivity, altered motility, immune activation, and microbiota imbalance. This complexity makes treatment particularly challenging. Functional gastrointestinal disorders include several clinically distinct conditions that include functional dyspepsia, IBS, functional constipation, functional diarrhea, functional heartburn, abdominal bloating. In particular, each condition has different symptom patterns, different triggers, but often overlapping mechanism because all falls under the umbrella of functional GI disorders. This overlap highlights the need for holistic rather than symptom-specific management. So let's focus on, let's discuss about management that currently we are and what we need. Traditionally, functional gastrointestinal disorders are treated using pharmacological approaches such as proton pump inhibitors, laxatives, antispasmodics, and even antidepressants. However, these come with certain limitations because all of the management that currently we are using are focusing more on symptoms of the disorder rather than care or proper management. Some side effects are associated with these therapies. These therapies also have limited long-term efficacy. Chances of symptom recurrence, as I just mentioned, that these are symptom-specific treatments rather than proper management, and also poor patient compliance due to high cost and increased side effects. So in this context, dietary assessment and lifestyle modifications are now considered essential first-line strategies. We are discussing mainly with the functional gastrointestinal disorders, but if we are looking in proper use of food supplements, these are the benefits are not only limited to the gastrointestinal disorders, but also extra-intestinal disorders like metabolic disorders. Even we develop a supplement for depression, and it worked well. This leads to an important question. Everybody is asking me a question. Most of the people are putting question on ChatGPT now on Google to search for the answer. That can food supplement play a therapeutic role? The answer is increasingly yes. It is actually not a therapeutic role, but a preventive role, because now most of the population are coming towards using food supplement nutraceuticals for their primary health. In one study by 𝒂𝒎𝒂𝒅 that was published in 2014, he mentioned that over 80% of world population is now interested more in natural products or vegetable extract for their primary health care. The reasons are many, but actually the people are coming more towards preventive care rather than therapeutic care. So food supplements work well, but we need to identify that which subject is candidate for the food supplement, and which candidate is and which one is candidate for the pharmaceutical. So while using food supplements, we need to identify subject that would be on pre-disease stage, not on disease stage. For example, if a person has diabetes, so he will use pharmaceutical for the treatment. But if a person has pre-diabetes, or if he carries a risk for diabetes, so he can use food supplement to prevent the occurrence of diabetes. In case of intestinal disorder, if a person has structure abnormality, so he will use the pharmaceutical. But in case of functional GI disorders, no one will identify a structure abnormality, because functional GI disorders actually occur in the absence of structure abnormalities. So in this case, a person will be a candidate for food supplements rather than pharmaceuticals, because here you need to prevent the pathophysiology or the development of advanced GI disorders. So why food supplements, and why the global supplement market is increasing year by year? It is because of the safer profile, better patient acceptance, and it is also because that it target multiple pathways simultaneously, because normally a food supplement contain a complex of or a combination of different functional ingredients. So most of the food supplements target multiple pathways simultaneously. If we look at the global supplement market, it exceeds $200 billion, with gastrointestinal and metabolic health being major segments. This reflects both clinical need and patient demand. So now, before moving towards studies, in this presentation, I will present, in this lecture, I will present results of three different studies. Our work is mainly with the development of food supplements. First, we do preclinical studies, then we do then we develop a food supplement, and then we move towards clinical study before marketing of the product. So in this lecture, I will present results of three different studies. It will not take much time. So then we will analyze in conclusion that whether the food supplements worked in clinical scenarios or not. Our research focuses mainly on development of nutraceuticals and functional food ingredients. We also valorize food waste, not only to improve human health, but also to promote green environment. Chemical characterization of bioactives, because it is very important when we do research studies on bioactive ingredients, because normally bioactive ingredients contain a combination of different ingredients. So we must know that actually which ingredients are present in the food supplements. If it is a food fiber, so it will work on different mechanism. If it contains polyphenols, it will work with different mechanism, not only mechanism, but we will also need to take care about the processing of the ingredients, because polyphenols are more sensitive to the environment. Fibers are less sensitive to the environment. In extraction of fibers, we can use moderate heat. In extraction of polyphenols, we normally do extraction on low temperature to preserve the polyphenol contents. Investigation of mechanisms of bioactivity and in vitro bioaccessibility and bioavailability determination. This is a very important part of our research, because before moving towards a clinical trial, we also interested in we are also interested in to determine that actually which components will be bioaccessible for absorption and in how much quantity. It is not a thing that how much and which components are actually present in the food supplement, but the most important part is that actually which components and in how much quantity will be available for the absorption from intestinal tract into the systemic circulation. Normally, most of the ingredient gets destroyed or degraded in digestive environment. So if a food supplement contain, for example, about 30 ingredients, so maybe only 9 or 10 will be bioaccessible for the absorption. If we are interested in the bioactive components that are normally degraded in digestive environment, so in that case we develop food supplements with special coatings, like we develop encapsulated nutraceuticals to preserve the or to protect the bioactive ingredients from degradation in digestive environment. Overall, this work aim is to bridge natural products with the mechanistic science and then with the clinical outcome. So it make a triangle between natural products, mechanistic science, and clinical outcomes. Now come towards the research studies. The first study was to determining potential or efficacy or effectiveness of multi-enzyme food supplement for functional dyspepsia. The study was randomized, double-blind, placebo-controlled clinical trial, and it was carried in a single center. So we called it as monocentric. How much was the quantity of enzymes present in the capsule? It contained one capsule contained 200 milligram of digestive enzyme blend, and that contained protease, amylase, lipase, cellulase, and lactase. The main aim of this food supplement was to improve the digestion. Normally, dyspepsia occurs in people with poor digestion. So for digestion, we need enzymes. So we developed this capsule that contained 5 different enzymes important for digestion of carbohydrates, proteins, all the multi and even lipids. The primary outcome of the study was quality of life that was identified through Nepean Dyspepsia Index questionnaire, and the secondary outcome was quality of sleep. Now, what were the results? Taking Poolzyme food supplement daily with meal, we asked participants to take this food supplement with major meals that included lunch and dinner. Because normally in lunch and dinner people take too much meal or ingredients. The results showed that it improved common upper gastrointestinal tract symptoms, and it also increased overall quality sleep quality by 26%. This is important because GI discomfort often disrupts sleeps. So improving digestion will improve overall well-being. Here also you can see the results that how it was. You can see on the left in the first figure, you can see on the left side for the placebo that the questionnaire score was increasing because patient was taking placebo, so it was expected that the score will, either the score will be unchanged or the score will be increasing because the patient condition got worse. In the second one, in the pink one or the red one, you can see the results for the enzyme supplement. You can see that it significantly decreased the questionnaire score right from the baseline to 60 days, and you can see that it is the score is decreasing straight from baseline to 30 days, and then from 30 days to 60 days with same pace. In the second figure, you can see PSQI questionnaire score. That is for the sleep quality. So you can see that the placebo score from baseline to 30 and 60 days, it was almost unchanged. But you can see a significant improvement in PSQI score with the multi-enzyme supplement. Here you can see a preclinical evidence that was published by our other colleagues in other university who are collaborating with us in different studies. And actually, we used this study to formulate our hypothesis for the clinical study. And here they reported that simultaneously gastrointestinal digestion of 2 meals using fungal enzyme formulation that improved the digestion of fats by 261%, the digestion of proteins by 22%, and digestion of carbohydrates by 20%. How we can interpret overall these results? I mean, the clinical evidence from our lab and the preclinical evidence from the Duncan lab. How actually enhanced nutrient breakdown will result in reduced gastric burden, and it will also improve motility. So as the result, it will show symptom relief, and it will also improve patient comfort. Here you can see the results. We published these results in Biomedicine and Pharmacotherapy, one journal from elsewhere with impact factor around 7.5. In the second study, we developed a food supplement, actually Lexomao, that was rich in dietary fibers. It was developed from Malva sylvestris extract. The supplement contained chemically characterized Malva sylvestris extract. The participants were 56 adults with functional constipation. Actually, this was a first supplement from Malva sylvestris. So we developed a food supplement from this plant, and then we did a questionnaire-based survey study without including placebo, just to report that whether this supplement will work or not. And currently, we are in process of detailed randomized clinical study controlled with the placebo to actually determine the effectiveness and tolerability of this food supplement as compared to placebo. But here I am presenting results from a survey. So in survey, we did not include a placebo. The duration of the study actually it was for 20 days, and the dose was 20 ml per day. That was corresponding to 750 milligram of Malva sylvestris extract per day for each participant. The primary outcome of the study was frequency of gastrointestinal movements. We can also call as bowel movements per week. Actually, we analyze bowel movements every week, so that's why we did it by we mentioned it bowel movements per week. The secondary outcome was stool consistency. That was analyzed through Bristol stool form scale and abdominal pain. That was with visual analog scale. Here are the results. You can see three different graphs. The first one is for bowel movements per week. You can see that a significant improvement of bowel movements per week from baseline mean T0 to T1. T1 is actually after 10 days, T2 after 20 days. Then you can see a visual analog scale for abdominal pain that it actually significantly decreases the score from baseline to 10 days and then to 20 days. Finally, you can see the Bristol scale for stool consistency. You can see not too much significant like bowel movements, but still the results was significant from baseline to 10 days. You can see in all these three figures that it improved the score for bowel movements, for abdominal pain, and for stool consistency from baseline to 10 days. After 10 days, it showed a significant improvement in the questionnaire scores. But then it maintained same score from 10 to 20 days. So it showed us that if someone take this food supplement even for a shorter period of time, for a week or for 10 days, so it will show improvement in his symptoms for functional constipation. Additionally, you can see we analyze there was no placebo, but we analyze male and female differently, and then we compare the results. That whether the results, because female are more prone to these symptoms due to hormonal changes, so it shows that there was no significant difference between the genders, between male and female, either on the baseline and then with the food supplement. So we can conclude that this food supplement will work almost at same pace in both male and female. As this was a plant extract from Malva sylvestris, so it was important that before moving towards randomized placebo-controlled clinical trial, we needed to determine the active constituent of this extract. We ran the chemical characterization through LCMS technique, both on negative ionization and in positive ionization. In negative ionization, it shows the presence of 32 compounds that included phenolic acid, flavonoids, and lipids. In positive ionization, it showed the presence of 16 compounds, including flavonoids, acetamide, carotenoids, lipids, and chlorophyll derivatives. Additionally, we also analyzed the presence of fibers, because Malva sylvestris is normally rich in dietary fibers as reported in the literature. For determination of fibers, we used a manufacturer kit, and we used same instructions that were given by the manufacturer along with their kit. It showed that 100 gram of extract contained 2.7 gram of insoluble fiber and 5.9 gram of soluble fibers. Both insoluble and soluble fibers work differently. In gastrointestinal tract. We published these results in Nutrients in 2024. Also, Nutrients is Q1 journal from MDPI with impact factor around 5. Now, let's move towards final study that is about 𝑭𝒐𝒏𝒂𝒍. We developed a food supplement 𝑭𝒐𝒏𝒂𝒍. Currently, the study is in progress for some other symptoms and mechanistic targets. So I have to discuss some of the results here, while the other results are currently in progress. So I don't have, but I will discuss the results that I have. 𝑭𝒐𝒏𝒂𝒍, actually it contains a 𝑐𝒏𝒂𝒏. Maybe most of you have known about the fruit 𝑐𝒏𝒂𝒏. The supplement of 𝑭𝒐𝒏𝒂𝒍 contained 500 mg of fruit extract per capsule. That was equivalent to 0.5 milligram of isoramnitine. Isoramnitine is actually a polyphenol ingredient, a flavonoid. Actually, 𝑐𝒏𝒂𝒏 contain a list of polyphenols, but isoramnitine is the major polyphenol of 𝑐𝒏𝒂𝒏. So we standardized our food supplement for isoramnitine. So if we market this product, and we are going to market this product hopefully in 2 or 3 months, it will be standardized to 0.5 milligram of isoramnitine, which is very important in medical and pharmaceutical practice. If a food supplement that is not standardized against isoramnitine and it contains less amount of isoramnitine, so maybe it will not work. People will say that this food supplement is not working properly, but actually it must be standardized against 0.5 milligram of isoramnitine. And why I am forcing on this point, if you find this product, we are going to market this product in Europe actually, but if in Pakistan you find this product and if they do not mention that it is standardized for 0.5 milligram of isoramnitine, so you can not take the supplement, because it must contain the actual constituent and the actual amount of those constituent that will work properly. What was the study design against is it was a randomized double-blind placebo-controlled clinical trial. Adults with functional constipation were recruited in this study, and that was supposed to take 1 capsule of food supplement or placebo per day for 28 days. The primary outcomes included frequency of spontaneous complete bowel movements. The secondary outcomes were stool consistency, severity of characteristic constipation symptoms, use of salvage treatment. What is salvage treatment? Salvage treatment is actually a treatment that were needed to relieve from constipation symptoms. For example, if a patient need laxatives for his symptoms, so we can call it salvage treatment. If he is taking our food supplement and also he need laxative with our food supplement, though it means that actually our food supplement is not working that much. So it was important that what was the ratio of salvage treatment usage along with this food supplement. And finally, the quality of life. We analyzed quality of life, quality of sleep in all these studies because the gastrointestinal symptoms can disrupt the life quality, and it can also disrupt the sleep quality. So that's why these are some important secondary outcomes that need to be determined along with the primary or other gastrointestinal symptoms. Here are the results. The results are not much clear, because I told you that actually the study is in progress. So I don't have a more clear picture of these results, but last night I tried to download some of the results from our study. But let me summarize that actually what were the outcomes. The food supplement based on sea buckthorn extract, it significantly improved the bowel movements, it significantly improved stool consistency, severity of symptoms, and quality of life. The effect on salvage treatment was significant, but it was less significant as compared to bowel movement, stool consistency, and symptoms severity. Let's come towards the mechanistic insights, that actually what were the mechanistic targets of sea buckthorn that resulted in improved constipation symptoms and improved quality of life. So first of all was to determine the effect of sea buckthorn on the hydration of intestine. Normally, in constipation, we try to take more and more water. Uh, uh, this is because increased hydration of intestine will result in improved constipation symptoms. Aquaporin 3 are specialized channels present in intestine, and aquaporin 3 actually work for hydration of intestine. If aquaporin 3 work well, or if it express well, so intestine will get more hydration, and constipation, the chances of constipation will be low. If aquaporin 3 expression decreases, or if it not works properly, so it will result in decreased intestinal hydration, and as a result, the chances of constipation will be higher. So here you can see the effect of 𝑭𝒐𝒏𝒂𝒍. In the first, it is on cell viability. You can see that the cell viability was good while treating the cells with food supplement. So it showed that the concentration that we choose is safe for using on cell cultures. In the second figure, you can see the effect of 𝑭𝒐𝒏𝒂𝒍 food supplement on aquaporin 3 expression, and you can see a dose-dependent increased expression of aquaporin 3 channels. You can see the food supplement from 7 microgram per ml to 70 microgram per ml, and it shows increasing expression of aquaporin 3. After 70 microgram per ml, it showed no effect on aquaporin 3 expression, and also below 7 microgram per ml, it showed no effect on aquaporin 3 expression. So we concluded that the actual concentration which will be important for aquaporin 3 expression is 7 to 70 microgram per ml. The next one is very important activity that was on gut microbiota, and maybe most of you are aware of gut microbiota. Gut microbiota is a very hot topic nowadays in medical and pharmaceutical science. Most of our health issues are directly or indirectly linked with gut microbiota. So if a person has healthy gut microbiota, he will have good health. He will have less chances of chronic disorders, not only intestinal disorders, but also extra-intestinal disorders. Normally, these gut microbiota synthesize or secrete different metabolites that we call as short-chain fatty acids. And these short-chain fatty acids are actually responsible for promoting good health. So these short-chain fatty acids, we can also call these postbiotics. These are actually a connection between gut microbiota, our nutrition, gut microbiota, and then our health. What was the effect of olive oil lex on gut microbiota functionality? We analyze gut microbiota in two ways. One is gut microbiota abundance and composition, where we take interest in analyzing the composition of gut microbiota, that whether the composition or concentration of good gut microbiota strain increases or decreases. If it decreases and a concentration of pathologic microbes increasing, so it will show us dysbiosis of gut microbiota. And in case of dysbiosis of gut microbiota, we will have decreased concentration of postbiotic, I mean short chain fatty acids. So as a result, negative health outcomes will occur in the form of different diseases. Normally, it target our intestine, but it will also target our other health. For example, our metabolism will be poor. Respiratory tract can be affected.
Excuse me,
Brain
sir.
can be affected. Yes.
Excuse me, sir. Respected sir. Just a gentle reminder that your time is about to conclude. Please summarize it.
Okay. Okay. Thank
Sorry.
you. Okay. Okay. It's okay. No
Thank
problem.
you, sir.
So it shows improvement of gut microbiota functionality with the olive oil lex, as we see increasing concentration of acetic acid, propionic, butyric, lactic, and succinic acids. Here are the chemical characterization. It shows 23 compounds: flavonoids, phenolic acid, ellagic acid. Quinic acid was actually the most abundant compound. And these results, the mechanistic results were actually published in Foods, a Q1 journal, I think around 5 impact factor. So let me summarize. Among all three studies, we observe multi-target mechanism, synergistic bioactive effects, clinically meaningful improvements of gastrointestinal symptoms. Key bioactives, for example, enzymes improve digestion, fibers improve motility, polyphenols improve microbiota and inflammation. So all these highlight the power of combination of nutraceutical ingredients. To conclude, food supplements are safe, accessible, and effective. Clinical evidence support their role in functional gastrointestinal disorders. They enable early intervention strategies, as I mentioned in the first slide. They are well tolerated with minimal side effects. However, more research is needed for optimal dosing, long-term effects, and personalization. I can say that the future of gastrointestinal care lies in evidence-based, personalized nutraceutical interventions, where diet, microbiome, and individual physiology are all considered together. Thank you. I would be happy to take questions and also discuss potential collaborations.
If you have questions in chat box,
Let me see the chat box. Okay, first question is why are polyphenols sensitive? Can we detect gastrointestinal through endoscopy? Lastly, which supplement should the doctor prefer to patient during diabetes, neuroceutical food supplement, or diet full of fibers? So first come towards the first question, that why are polyphenols sensitive? Actually, it is because of their structure. They are polyphenols. Polyphenols mean they contain multiple benzene rings and multiple hydroxyls. So due to the presence of too many hydroxyl groups, they are more sensitive to the light changes through light, and also to oxidation reduction reaction. So when we expose these to extreme environment, for example, temperature to the environment, to the light, so there will be chances due to more hydroxyl groups that they will degrade through oxidation and reduction reaction. So that's why polyphenols are sensitive. Can we detect gastrointestinal disorder through endoscopy? I think yes, but this question is not related to my specialty. Maybe you can ask it to a medical doctor, and he will answer it more better. Then, which supplement should the doctor prefer to the patient during diabetes? Food supplement or diet full of fibers? This question is a little bit tricky. Let me explain in easy way, but actually it was not a theme of current talk, so I don't know if you will understand well, but you can write me through email also. If a person is taking a diet that may contain fibers, that may contain polyphenols, so it means he is taking diet full of bioactive ingredients. Here he will have a problem that normally people respond differently to different diets, because from diet, first you will need to digest the diet, then you will then your digestive system will need to release the bioactive ingredients from that diet. So normally different bioactive ingredients cross-link with each other in diet. So normally they are not that much accessible for health effects or for absorption. Some of ingredients release through gut microbiota digestion in the colon from the diet. So a diet full of fibers or full of polyphenols, it will not be clear that how much fibers and polyphenols a person will take from that specific diet. In case of supplement, we extract the bioactive ingredients that are responsible for the specific effect. So it will work well because you are taking directly those bioactive ingredients, and you will not need to release those bioactive ingredients from the diet. The example is if you are taking tomato full of fibers, and if you are taking husk, in extreme conditions or for our constipation, we normally take husk because it is full of fibers, but it contains only fibers, not other ingredients. So this is the actual thing that we are considering food supplements over diet in people that are prone or carries risks to the specific disease. But if a person is completely healthy, so he will prefer diet more. Then is there any interaction between the supplements and medication, and what is the risk of toxicity associated with them on longer use? Yes, there is interaction. For example, if a person is taking food supplement that may contain some amino acids, amino acids are also precursors for some neurotransmitters. So if a person is taking If a person is taking, for example, medications for his depression, and he is also taking a food supplement that is rich in some amino acids, for example, tyrosine, tryptophan, etc. So he may face a risk of serotonin syndrome. That will include rigidity of the muscles, increased fever, sweating. So this is just one case, but yes, in all cases, there may be risk of supplement and medication toxicity. So before taking food supplement, you must notify that to your doctor if you are on some medication, or to pharmacist in pharmacy if doctor is not accessible. So he will guide you that actually you can take this food supplement with this medication or not. The risk of toxicity with the longer use, it depends. It depends on the supplement. If you are taking a food supplement rich in fiber, so there will be no risk. In polyphenols, there will be no risk. But if you are taking higher dosage of the food supplement, for example, quercetin is a
Kindly, sir, unmute your mic.
okay.
Thank you, sir.
Can I continue with the questions?
Ji, sir.
Okay. Okay, the next question is, I was discussing about quercetin, but if you are taking increasing concentration of quercetin, you will be at risk of oxidative stress. People are taking turmeric rich in curcumin, but if he is taking increased concentration of curcumin, or if he is taking curcumin for longer time, so he will be risk of hepatic toxicity. So the toxicity will depends on the component of the supplement. The next question is, to what extent can psychological therapies be as effective as pharmacological treatments in managing functional gastrointestinal disorders? Normally, psychological therapies are not too much effective in managing gastrointestinal disorders, but actually psychological therapies, people are taking these psychological therapies to improve the quality of sleep and overall quality of life, but not it is not related with the gastrointestinal disorder symptoms. The next question is, can the efficacy of this nutraceutical is comparable with medicine? No, the efficacy of nutraceutical is not comparable with the medicine. It is because that it take much time to produce their effect. But I mentioned in start of the lecture that food supplements are not designed for the treatment. It is designed for prevention. If a person has established disease, so he must go with pharmaceutical treatment, with the medicine. But if he has no disease, but he carries a risk for a chronic disease, so